Okay, welcome everyone. Thanks for joining. If you're new to this group, my name is Emily. I work with Minnesota Valley Action Council, and we try to do a quarterly networking meeting for anyone interested related to employment and training related programs or resources that we could share amongst our clients. So that's kind of the setting. We usually start with a guest speaker for the first 15 to 30 minutes and then move into roundtable so that anyone on the call can share about their agency, maybe upcoming events, program changes, those sorts of things. So our speaker today is with COPAL. So I'm going to let her kind of take over here. Welcome, Natalia.
Thank you, Emily. Yes, my name is Natalia Orosio, and I am a health promoter and program specialist for COPAL. Is it okay, Emily, if I start sharing my screen? Perfect.
Yes.
Okay, let me put it in. Let me just, okay. Oh. Let me see if I got this. Okay. I hope I do. Yes. Okay, nice. Oh, well. Maybe I should not share my screen because it's having me present in Teams because now you guys can see it like I do. So
yeah, I think.
Okay, there we go. Stop sharing. I was looking for the stop sharing button. Oh my goodness, technology is just not my my greatest strength.
Yes, we all have those times, so no pressure.
Let me try it again. Okay, let's see. This one. Okay. Oh, but you can, I have not had this issue before. Okay, let's see. Stop sharing.
It might be that you have to present it and then share your screen, but I guess if you only have one screen, that might prevent you from seeing your presentation notes. So
yes, so I think I'll just share it like this. Okay, there we go. Oh no, I put present Teams. Don't you dare, don't load. Okay. Okay, there we go. It's this button up here. There we go. And just making sure, can everybody see my screen?
Yes, thank you.
Thank you. Okay, so COPAL, what is COPAL? COPAL stands for Comunidades Organizando el Poder y la Acción Latina, which translates to Communities Organizing Latino Power and Action. I just want to see if I could see you guys at least over here.
How's it going?
So,
not too bad. How are you?
Just working and trying to pay attention.
Sorry about that.
It happens. It happens. No, so sorry. I just wanted to make sure that I could at least see a little bit over here. There we go. Okay. Next slide. So about us, what is COPAL? So COPAL is a member-based organization that has been established in 2018 to improve the quality of life of Latin families. So over the past 6 years, COPAL has evolved to become a well-known grassroots power building and visionary transitional organization. And we are a force for social change with a shared vision for a better future for us all. And our mission in COPAL is we lead social impact initiatives to improve the quality of life for Latin families. And I will show later on throughout this presentation in how we practice that. Let's see, this one. Okay, there we go. Okay, and our locations. So we do have 3 locations where COPAL is. One is in Rochester, and I believe that building, that office area is relatively new. I think maybe about 2 years. And then the Mankato office, and then we also have the administrative office and the Primero de Mayo Worker Center. They are both located in Minneapolis. And then up here, we have our navigators line, which is 612-249-8736. And I will go into more of how important our navigators line is in accomplishing our goals. Oh, this one. Okay, so our focus areas. Our focus areas to reach our goals are environmental justice, health and wellness, organizing and leadership, worker center, South Central Initiative, and Southeast Initiative. And what do we do with all these focus areas? Well, we build collective power and transform systems and create opportunities. We work collaboratively to transform Minnesota into a place where every resident thrives and lives with dignity. And I think these focus areas, environmental justice, health and wellness, well, you see them there, and they're all just very important pillars in how we can transform the lives within our community. And all of these focus areas are just really important in order to achieve that. And we have, so these key projects and initiatives, we have the knowledge driving test at shared spaces. So we actually have, this comes from the Worker Center, and I will share later too, of a document that shows the other resources that the Worker Centers provide. But these are just some of the initiatives or the projects that we were able to bring from Minneapolis to Mankato. So in the Mankato office, every Thursday from 3 p.m. to 6 p.m., people can schedule their appointment for taking the driver's written exam. Very important, written, not driving. But people can take that with us. They can call that navigator's line that I showed before and schedule an appointment, and they will get they can get a copy of the book. We have now hardcover copies. Hardcover copies in the Mankato office available. That is also in Spanish. And this is also showing some other events that we have had. And this was an example of one from March 27th. And this was a vaccination event where we provided together with Open Door Health, we provided COVID-19 vaccinations, flu, child and youth immunizations, long COVID presentations. So my work as a health promoter for COPAL, I have had the opportunity to facilitate long COVID presentations with one of our doctors that we have on our team. His name is Francisco Ramirez. He is a really great partner in this. We have been able to facilitate like virtual lunch and learns. I had one a while ago at the Lincoln Community Center. I believe it was actually back in like February, earlier this year, but I was able to connect him virtually with our community, and we were able to facilitate a presentation on long COVID, and then also access to healthcare with MNsure resources and community services. And how we put this one into practice, this kind of event, is will maybe like a table event or just also outreach. We try to be in places where the community can see us. It could be in schools or restaurants or certain markets. And that is to provide information about MNsure and other community resources. And then we also have our regional committee meeting. And this was one of them that was on April 12th here in Shared Spaces where the COPAL office is in. And these regional committees meetings have been so important in building a relationship with the community and hearing like the needs and the concerns and the actions that they want to take. And together we strategize and about what are the changes that we want to see and how to implement them. And this is also the Immigrant Defense Network, and this is all around Minnesota State. These are, yes, I want to clarify that, yes, this isn't just for Mankato. This one is all around in Minnesota. And then the Worker Center Primero de Mayo Workforce. And I just quickly want to share a little bit more about the Worker Center. So my position as program specialist, this is a little bit newer for me, but what the Worker Center does, well, we provide many opportunities for people to be able to apply for. And this is one of them, the CNA one, but I like to start with this one that has an overview, just a quick overview of what the Worker Center is. And now there is another page that is in Spanish. It's the same information, but in Spanish. So what the Worker Center's Primero de Mayo is, we have jobs and careers for adult or opportunities, I should say, that our community can apply themselves to. And the ones that I am bringing from the Minneapolis office to the Mankato region is completing the forms for GED. If somebody wants to get their GED, instead of having to go all the way to the Minneapolis office to fill out those paperwork and those documentations, people are more than welcome to come to the Mankato, office, and I could get them registered for that GED. And then also I'll be facilitating down here. We have our CASAS exam, and what this is, it is to find out your level of English, because some jobs do require a certain level of English speaking. So we just want to make sure that our community will be able to fill that job. Have access to Zoom, very important because classes are virtual, and also to become a member of COPAL and provide identification. Oh, yes, Emily.
I was just gonna say, if you were sharing a different screen, it wasn't showing up. So if you have documents to share after, I usually type up all our notes and send it out to the whole group. So I just wanted to let you know, if you were sharing like a document, we still see the PowerPoint.
Thank you. I am so sorry. Yeah, I was sharing the document, but yes, that was kind of an overview of the Worker Center. Yes, and I will share that document with you, and then people will be able to see it and let me know if they have any questions. So sorry about that. Let me just go back to presenting this one. And it started all the way from the beginning. But yes, those were just some of the ways of how we can bring back some of the resources and information from the Minneapolis office to the Mankato office. And then this is very important, the navigator's line. And I mentioned it before that people can call this number 2 to schedule their appointment for driver's exam. But the navigator's line is direct support for Latinos families seeking resources. As I have shared, they do speak in Spanish and in English. And what do I mean by seeking resources? It could be help with housing programs, for their kids to be in during the summer, or yes, GED, applying for that, or even finding a community clinic near them that some people could struggle. It's quite hard. Yes, it is quite hard to find some of these resources. So our navigators line, we encourage our community to give them a call when they need assistance in looking for our resources. And we keep track of the resources that can be found in Minnesota and have them organized by what kind of assistance. And our navigators, yes, can definitely help people. And by doing this, the navigator sign, this is also the initiative to strengthen access to local and statewide services. Cool. Okay, and this is our call to action. So to be part of COPAL means to support our initiatives and community programs. And what those do, they expand resources and outreach. This is how we help Latino families connect with services, and together we build stronger and healthier communities. And I also did just want to comment, and this is my supervisor's contact, Lourdes, at COPAL.org. I'll be more than happy to share my contact information as well. But what I wanted to quickly comment is that is that even though COPAL is for Comunidades Organizando el Poder y la Acción Latina, the Action Latina, but I think uplifting one community, because in this community there are mothers, there are doctors, there are students, there are so many different kinds of people that also fit into other communities. So I believe, and it is COPAL's mission, not only to uplift the quality of lives for Latino families, but overall for all of Minnesota too. Thank you. Let me know if anybody has any questions.
Thank you so much for your presentation. Does anyone have any questions? As I stated, I can certainly share the PowerPoint and any flyers that they share with me with the whole group afterwards as well. But any questions? And if not, I can certainly share Natalia's contact information if something comes up later when you're interacting with clients, if you have a question about that. Yeah. And then if nobody has questions, Natalia, you're welcome to stay on the call and kind of listen to other agencies share. Otherwise, if you have to take off, you're welcome to, leave the meeting if you need to. So either works. So let's see.
Thank you, Emily.
Yeah. Any questions or anyone want to get started on roundtable updates? I can go if not. So energy assistance applications are available now if anyone is watching for those, so they can be found on our website. I think I'll have to check. I think we might have hard copies too, but if not, it's on our website. And or if participants have applied before, they likely would have received a pre-filled application. So if anyone says, yep, I've applied before, have them check their mail first. Other than that, we always have our Pulse newsletter. So if anyone's looking for updates on any of our programs, we try to keep that updated in that link. I'll put in the follow-up as well, but it's on our website too if you're just looking for a link to our resources. Our employment and training programs do have some openings yet with a variety of different eligibility for individuals looking for possible training or employment related resources. So when in doubt, definitely just reach out. But that's kind of all I have. Does anyone else on the call from MVAC have other updates about departments that I didn't speak on?
I can share a little. So the senior program has now taken in Scott and Carver counties. So we will be serving those two counties for the senior program now. We are starting to get full on our enrollment, so we will start waitlisting participants here soon.
Kim, do you have an update on youth too? There was a chat asking about just, I think, a brief overview of if we're taking youth, is how I interpret the question.
Yeah, we are currently enrolling youth. We are low on funding for work experiences, so we're not doing too many of those, but we are still able to help with other areas of career development. Were there any questions specifically on like what the youth program can do or?
It just says, would you be able to share a bit about youth employment? So did that answer your question, Suzanne?
Yeah, so to get enrolled in the program, you meet with a career counselor here at MVAC, and we do have an intake process. There are a few things that we need before we can officially enroll someone, and they do need to have a social security card. Once they are enrolled, we can start working with them on career development. We do like education, work readiness, occupational skills, training as well. But for the enrollment process, we help them out with that. To start out, though, they do need an ID and social security card.
Yep, and I can put links, but we do have referral forms right on our website that they just fill out, and then a enrollment counselor would reach out for both senior and youth. So perfect. Thanks, Kim. Any other agencies that have, yeah, go ahead, Paige.
I can go next. Paige with Vine, and if you've been to our building recently, you'll notice that we are under construction. Our building is still open. Our old entryway is now torn up, so we have a new back entryway that is on the southeast corner of the building, basically across from Fifth Street. So you can still get into the building, but where you probably are used to getting into the building, it is no longer open. Hopefully our construction will be wrapped up by the end of the year and it won't become an issue. I also wanted to mention we have the Love Your Age Vines 55 Plus Expo coming up next Tuesday. That's September 16th from 1 to 4 p.m. at the Mankato Civic Center. We've got over 90 vendors that are signed up to participate, and a variety of different things going on. Free balance assessments. We have a flu shot clinic going on, free blood pressure checks, variety of different entertainment, speakers, and music, and some free snacks and goodie bags and door prizes. So check it out. We also have a diabetes prevention program starting next Tuesday. So we are still taking people in for that. If anyone is interested, it is a free and open to the public program. Only qualification is that you are pre-diabetic or diagnosed as pre-diabetic. The program is a year-long commitment, and it'll start meeting on Tuesdays from 9 to 10 a.m. at the Vine Adult Community Center. And then we also have Rake the Town coming up in November. So our Rake the Town dates this year will be November 1st through the 9th. So we're looking for volunteers to either volunteer as a group, or if they sign up individually, that's fine. We can pair them up with others as well, and we'll supply all the needed things to do the raking for older adults in our community. So that's throughout Blue Earth and Nicollet counties. And all the stuff I just talked about is available on our website, vinevolunteers.org, for more information, or you can give us a call at 507-387-1666. And Emily, I can send you all that information I just chatted about for you to send out to the group afterwards too.
Perfect. Thank you so much.
I can go next. I'm Annie. I work at MINRA, which is our local area agency on aging, and I'm a senior linkage line employee as well. But I just wanted to share that we actually have a new name. So we are not called Senior Linkage Line anymore. We are now Minnesota Aging Pathways. I will send a link here just to our website. And then I just wanted to share quick too that Medicare open enrollment period is coming up. It's October 15th to December 7th. And just a reminder, if you don't know, that's one of the biggest things Senior Linkage Line helps with. If anyone has any questions at all about Medicare, anything, you can give us a call and we can help you navigate through that process, see if there's a better plan for you. Yeah, just wanted to mainly update you. If you could put that in the newsletter to Emily about our name change, that'd be great.
Yes, I can do that. Thanks for the reminder. Any other agencies with updates? It looks like in the chat, it was shared that there is an event potentially of interest September 23rd, the State of the Nonprofit Sector with Minnesota Council of Nonprofits, as well as the 24th. It says Meet the Funder Nonprofit Networking, Taylor Family Farms Foundation. And then it also mentions a note about having space for rent for nonprofits at shared spaces. So I just thought I'd read that off in case anyone didn't see the chat. Yeah, Natalia, you have a question?
Yes, just quickly, this was my bad because I thought that the screen was being shared earlier and it wasn't during the document, and I just quickly wanted to add in what was involved in the which I will be sending was in the Worker Center flyer was also a program for CNA. People can get their CNA certificate and they can apply with COPAL, and we can administer that for them. So if there's any questions about that too, or if you want to refer to someone who's looking for a career opportunity in the medical field, there is that program. Thank you.
Perfect, thanks. Yes, MVAC too has a couple grants that just require being under 200% of poverty, training only. So we try to partner it with another program like SNAP, Employment and Training, or MFIP, but that is for healthcare, manufacturing, and or CDL related training. So yeah, lots of good resources to share. That's awesome. Perfect. Any other updates or changes that you'd like shared, or any of those things?
Okay.
Go ahead.
Hi, my name is Ikran, and I'm intern here at Lutheran Social Services Crisis Nursery. So we provide free care 24/7 for children and support families. So there's no income guideline or no cost to the families. It's also a short-time care for children and age 12 and younger by a licensed provider. We help parents dealing with personal stress or going through crises such as illness, housing problem, and other issues too.
Thanks.
Yeah.
I was just gonna take a look because I thought somebody had emailed me that they were gonna miss the meeting, and it just dawned on me that they maybe wanted me to share something. Let's see here. I think it was related to ABE. I know she was gonna have, I don't know if anyone else is from ABE on the call that had any updates to share. If not, I'll look it up and I'll share it with the follow-up that I type up. Just want to double check once more that I'm not missing any flyers that were shared with me. But yeah, as always, I try to type up a overview of everything that was shared on the call. Let's see. Everything that was shared on the call with the whole group afterwards with links if anyone shared those as well as some flyers. So I will work on typing that up and getting it sent off. But I guess if anybody else has anything to share, now would be the time. Otherwise, I really appreciate the time you take to join the call and share resources so that we can kind of just be in the know about events to refer people to. So any final thoughts or questions or resources? If not, the next meeting I have on the calendar for Wednesday, December 10th at 1 p.m. and I'll try to get a link sent out sooner. But that's the next date, and I don't have a guest speaker lined up just yet. I've got some ideas, but as always, if there's a program that we haven't talked about yet or haven't shared, you're welcome to contact me or send me the idea, and I can research it to see if they'd be willing to share about their programs. So I appreciate your time, and I hope you all have a great rest of your day.
Thank you.
Yep.